Hello and welcome to the online class on amoebiasis. Upon completion of this online class, you should become thorough and you should be able to define and describe the characteristic features of amoebiasis, epidemiology and transmission of amoebiasis, what are the risk factors which are involved in amoebiasis, life cycle of Entamoeba histolytica, diagnosis, pathogenesis involved, clinical features of amoebiasis, management, prevention. Lastly, we'll be understanding the role and responsibility of community pharmacist. Amoebiasis is an infection of intestine caused by Entamoeba histolytica, an anaerobic protozoan parasite. Protozoa can reside in large intestine without causing damage to large intestine. However, sometimes it can invade the colon wall, causing colitis, acute dysentery, or chronic diarrhea. On this side, you can see the photomicrograph which reveals the presence of Entamoeba histolytica trophozoite displaying Limax type movement. Now coming to the epidemiology, amoebiasis condition occurs worldwide, but most commonly seen in tropical regions with crowded living conditions and poor sanitation like Asia, Africa, Mexico, and parts of South America. There are 50 million people are infected with amoebiasis worldwide. India has significant health problems associated with this disease. Amoebiasis affects about 15% of Indian population. There are 4 different species of Entamoeba. They are E stands for Entamoeba Histolytica, E disper, E moshkovsky, E Bangladeshi. Today in this lecture session, we mainly concentrate and focus on Entamoeba Histolytica, which is most common, which causing intestinal amoebiasis. The transmission of amoebiasis is mainly through fecal-oral spread of cysts. Amoebiasis can be transmitted via ingestion of cystic form, which is in infective stage of the Entamoeba histolytica. These cysts can be found in soil, water, or on the hands of food handlers, which is contaminated with the fecal matter. Fecal-oral transmission can also occur due to anal sexual practices. The incubation period for amoebiasis may range from 2 to 4 weeks, but even it can go up to few days to years. There are various risk factors for severe amoebiasis, which includes alcoholism, older or younger age, malnutrition, pregnancy, recent travel to tropical region, and suppressed immune system. Now let us understand how we contract with the amoebiasis. Here we can see the beautiful illustration of amoebiasis, the life cycle of amoebiasis. There are 2 stages. One is the cyst stage, infective stage. Infection happens here, infective stage, and one more stage is the trophozoite stage, where it can cause invasive diseases. Infection from ingestion of amoebic cysts, which is through contaminated food or water or through fecal oral route. These cysts can survive in environments from weeks to months. There are several stages of this life cycle. First, the cysts which will be ingested by the human beings in the environment. Now it goes to the stomach, it passes through the stomach, then the transforms to trophozoites in small intestine where it invades. Now in this stage where the trophozoites in the small intestine, they starts invading, it is becoming invasive. Now the trophozoites invades into the mucosa of large intestine, causing damage to tissues, increased secretions, and eventually there is a bloody diarrhea. So what happens? We have seen there are two stages, infective stage and the trophozoite stage, which is invasive disease causing invasive type of disease. There, the infection from the ingestion of the mature cyst, Amoebiasis, which will be present in contaminated food or water or either through fecal oral route. These mature cysts contain Entamoeba Histolytica. They can survive in environments from weeks to months. That is one of the interesting facts about this Entamoeba Histolytica cyst. And there are several stages. These mature cysts, when it is when it contains Entamoeba histolytica, when it is ingested by the human beings, which is present in environmental area, it passes through the stomach. Thereby, it transforms to trophozoites in the small intestine. Thereby, it invades the intestinal epithelium cells, large intestine, causing damage to the tissues, and it increases the secretions, and the patient may experience the diarrhea, which is bloody diarrhea. Next, in this slide, we'll be seeing the clinical features of Entamoeba histolytica. Firstly, some patients who are having a good immune system is very good, they remain symptomatic free. They don't have any symptoms. They don't experience any symptoms at all. And they clear the infection because of asymptomatic, because of their good immune system. Sometimes, in certain cases, amoebic dysentery is seen where the patient may experience abdominal pain, colitis, bloody diarrhea, and this local tissue damage and destruction is seen because of the damage to the tissue, and destruction is mainly because of bloody diarrhea. And again, it may turn to, in some cases, it may turn to, in addition to amoebic dysentery, it can cause abscesses now. Abscesses, it can cause, the primary targeting organ would be the liver. The liver is the primary targeting organ which can cause the liver abscesses, that is amoebic liver abscesses. And sometimes it can cause even the hematological spread from the GIT. So this amoebic liver abscesses is caused by Entamoeba histolytica. Here we can see the beautiful diagrammatic representation of liver abscesses, which can be seen through the CT image, the CT scan. We can see the abscesses here. Later, it can cause hematological spread because of this abscesses which has been made into the blood now. It can cause hepatomegaly, then weight loss, then fever may be experienced by the patients. There is right upper quadrant pain, flask-shaped intestinal ulcers will be seen, and sometimes there is a condition called as liver abscesses, which is anchovy paste. Here you can see the anchovy exudate. It's also called as anchovy paste exudate, which is from the liver. These are the specimens which is from the liver. These liver abscesses aspirate is usually the thick yellow-brown liquid, classically referred to as anchovy paste exudate. This liquid lacks white blood cells, so as a result of lysis breakdown by the parasite, these amoeba are visualized in the abscesses fluid in the minority of the patients who are having the amoebic liver abscesses. Sometimes it can go to other sites where it can cause lungs and brain abscesses, amoebic lung abscesses and amoebic brain abscesses, which is a very rare case, but it cannot be overruled. There may be the lung and even the brain involvement also. Now coming to the diagnosis aspect of Entamoeba histolytica. The diagnosis is mainly carried out by identifying the stools or the biopsy specimens, which will give you the really good data and which identifies very quickly the trophocytes with engulfed RBCs in the cytoplasm by detection of this one. So you can see here the cyst which can divide or binary fission is taking place up to 4 nuclei. So that may be giving you the real picturization, and serology is helpful and antigen testing may be helpful. Previously, the stool examination for ova and parasite was preferred method, but it has become now low sensitivity, and WHO says that has clearly recommended that intestinal infection can be diagnosed with the detection of Entamoeba histolytica antigen or DNA in the stool specimens. So in endemic regions, usually on the clinical basis, through non-specific, he is treated with giving anti-amoebic drugs now. Now coming to the pathogenesis of Entamoeba histolytica. 90% of infections are asymptomatic. They don't develop any symptoms at all because of their immune system. Sometimes the 10% of cases where they become symptomatic and where we can see there is the colonization of the parasite in large bowel is taking place, that is in large intestine. Later on, invasion of intestinal mucosa, and there is a via the intestinal mucosa there is the cellular or necrosis taking place, or sometimes it can cause even apoptosis, that is programmed cell death. Then there is the enzymes which plays a role, whether it is proteinase enzymes or the breakdown of enzymes, that is lytic enzymes coming to role over here, and it penetrates into the intestinal wall and it can cause the hematogenous spread, and the blood vessels, when it penetrates into the intestinal wall or blood vessels, there is a rupture is taking place, so we can see the bloody diarrhea and all those symptoms, and it invades the liver or other adjacent organs. So chain reaction of tissue destruction is taking place over there eventually during certain period of time, and we can see the flask shaped ulcers or abscesses or fistulas may be seen in the patient. This is the overall the pathogenesis of Entamoeba histolytica. Now moving on to the pharmacotherapy, here there are several antibiotics are available to treat amoebiasis. Probiotics may be helpful in certain cases. Treatment mainly depends upon the severity of the infection and the clinical condition of the patient. Usually, metronidazole orally for 10 days is given to the patient, and this is followed by paramycin or naloxone. If patient still complains of vomiting and weakness, then paramycin and naloxone should be given. Then patient may need the IV route. So they may give through IV route. Medicines to stop diarrhea are generally not given or not encouraged. Stool should be rechecked after treatment. So you should make sure that infection has been cleared completely, which is very rare practice in India. Now let us understand in detail about the following anti-amoebic drugs generally prescribed and should be dispensed on the prescription for amoebiasis. Metronidazole. So metronidazole, it kills propozyte of Entamoeba histolytica in intestines and tissues, but it does not eradicate cysts from intestine. So metronidazole is indicated for invasive type of amoebiasis. Tinidazole. Tinidazole, it is used to treat susceptible protozoal infections. Tinidazole is indicated for treatment of intestinal amoebiasis and amoebic liver abscesses caused by Entamoeba histolytica. In adults and children aged 3 years and older, the drug should be used only in adults and children over 3 years and older. Now moving to the next drug, that is ornidazole and secnidazole. This ornidazole and secnidazole, it exhibits similar actions to metronidazole in the treatment of severe intestinal and hepatic amoebiasis. Now moving to the next drug, that is diloxanide furoate. It acts as an amoebicidal agent. It is used in the treatment of intestinal amoebiasis in combination with other drugs, that is tinidazole. It has produced high cure rates in mild intestinal amoebiasis and in symptomatic cyst passers. So it exerts no antibacterial actions and is less effective in invasive type of amoebiasis. We should remember that thing. In India, this drug is available in combination with tinidazole. Now, the community pharmacist has to take certain special precautions while giving these drugs. The precautions which has to be taken by community pharmacist, such as in children and in pregnancy, it is caution is required, especially in children and below 2 years of age, that this drug is usually not given. Next drug is iodoquinol. It is a luminal amoebicide. It acts primarily in bowel lumen because it is poorly absorbed. It is best tolerated along with meals, so you have to take along with meals. It eradicates cysts of Entamoeba histolytica after the treatment of invasive form of amoebiasis. Next drug would be paramomycin. It is active only against the intraluminal form of amoebiasis. It eradicates cysts of Entamoeba histolytica after treatment with metronidazole or tinidazole for invasive diseases. Now we shall understand the role and responsibilities of community pharmacist played in the society. The community pharmacist plays a great role by creating awareness in the community. By creating awareness about good hygiene and proper sanitation is a huge challenge for people living in poor conditions in developing countries where there is little or no access to fresh water and disinfectants. Now, having said that, to minimize the risk of getting infected, a community pharmacist should spread awareness and to sensitize community regarding the sanitation. The following sanitation tips are given below will help to create an awareness regarding the prevention of amoebiasis. So the community pharmacist is helping the society in terms of spreading awareness and prevention of amoebiasis. Firstly, wash hands with soap water after using the toilet and regularly throughout the day, particularly after coming into contact with the infected person. Wash hands before handling, eating, or cooking food. Wash hands before handling babies and feeding children or elderly people. Keep minimum contact with an infected person. Avoid sharing towels. Wash the laundry of an infected person's clothes with hot water or probably with an detergent. What happens here? The community pharmacist can play a very great role in the society. He can give education and awareness message, and it can be communicated either through the posters. He can display the posters in the pharmacy store, which happens specifically in the rural areas or in such areas, slum areas, where still open defecation is practiced, must be targeted for education and awareness. Now, certain duties of community pharmacists like lifestyle habits now. Lifestyle habits plays a very great role in community awareness by spreading the community awareness. The lifestyle habits to be practiced in order to prevent contamination, which should be included for education and awareness, which are as follows. Now, we'll see one by one how to give education, how to promote education, how to spread awareness in the community. Do not drink the tap water directly, the local water. These are not safe measures. So safe alternatives are bottled water from sealed cans or bottles. Otherwise, drink boiled or boiled water which is for several minutes, or use chemical disinfectant or a reliable filter. So always prefer to drink the boiled water instead of drinking the tap water. Do not drink, especially from the public water fountains. Again, it's a very bad practice now. And here we can see the image here. The person is defecating outside, which is a very bad practice, which is happening in India. The government has initiated a program called as Swachh Bharat Abhiyan to stop this menace. So you should spread awareness how amoebiasis is very highly prevalent because of this open defecation. Do not drink the ice water, or because it may be made from local water, it may be infected with the again parasite. Again, use always do not eat such fruits or vegetables that cannot be peeled before eating. And do not eat or drink milk, cheese, or dairy products that have to be that is not pasteurized. So before drinking milk and other things, it should be properly boiled. So the main thing, the patient counseling is the fundamental responsibility of community pharmacist, and the principles of counseling is mainly on the 5A principles. So the 5A principles are the foundation layout for community pharmacist. Now in this class, in this session, we'll be understanding the 5A principles in a detailed way. What are the 5A principles? 1. Ask, assess, advise, assist, and arrange. Now we'll be seeing all these 5A principles, how we apply in community pharmacy practice in day-to-day scenarios, especially how you apply these 5A principles in amoebiasis now. what we are talking about. Ask. Here you are asking about the symptoms now. Now, next is the duration of symptoms and its frequency. Now, consumption of alcohol now. Now, you go one by one, you ask the questions now in a very correct manner as per the guidelines now, as per the 5 principles guidelines. Now, patient whether he is consuming the alcohol or not, you are asking. Next would be the drugs now. Which drug the patient is taking, or whether he is taking any drug, whether he is on any current medication. You are asking about the place of the patient, where do he stay, and you are asking the travel history of the patient. Next would be the assess. How you assess? You assess by asking question in this manner: the source of infection, age of the patient, and you are asking question to probably understanding of disease and drugs. Then whether the patient is alcohol consumer, I mean alcohol intake is done by the patient or not. Or you ask the patient in such a manner that the attitude towards quitting alcohol, what makes him, why he has made an attempt to quit the alcohol. So you're asking the good question. So because a very good question, attitude to quit the alcohol, or what should the patient, community pharmacist should decide himself to make the patient to quit the alcohol. How to change the attitude of the patient. Next one would be the advice now. Quit alcohol or quit consumption of alcohol. Take adequate rest. Follow always healthy personal lifestyle, hygiene and the sanitation. Adherence of the therapy. Medication adherence is very important. Self-medication should not be practiced at all. Next one would be assisting, the assist. That is the fourth principle of the principles of counseling. What assistance can be given by the community pharmacist? Assessment in the drug-related problems regarding about the problems which are associated with the drugs now. That may be drug interaction, that may be the patient compliance. Finally, the fifth principle would be arrange. You are referring to a doctor, or you are given reference to a doctor or follow for monitoring the effectiveness of therapy. So whatever you do, you initiate all these 5A principles: ask, assess, advise, assist and arrange in this manner. Now, let us move to the patient counseling, which has to be given by the community pharmacist regarding about the drugs. The community pharmacist should provide a standard advice to the patient regarding about the drugs, considering the 5R principles, the rationality of the drug principles. So, the outcome is usually good with treatment with antiprotozoals. Usually the illness lasts about 2 weeks and it can reoccur if treatment is not proper and hygiene is not maintained properly. You should advise the patient regarding about why he is, you should try to understand why he is not adherent to the therapy. What makes him to not adhere to the therapeutic guidelines or prescriptions now. You should try to understand what there is a problem, whether there is a financial problem associated with the drug therapy, or whether there is a what makes him to lack from the adherence of the drug therapy, and which gives the improper results now. Now instruct the patient to take the missed dose, warn not to take a double dose to make up for a missed dose. That is very important, which has to be told from the community pharmacist. Never and ever take the double dose for a missed dose. So drug specific counseling may be provided to ensure effective and safe therapy. So you should counsel in such a manner that which should be effective and which should be for the safety of the patient. Now let us understand the counseling regarding about amoebiasis treatment now. How to counsel and what are the important measures have to be taken while counseling now. On this side we can see the drugs or brands, on the middle side effects, and here it is the counseling emphasis. First drug, metronidazole. The side effects would be the bitter or metallic taste in the mouth, nausea, vomiting, GI upset, all GI upset. We can see all gastrointestinal upset is experienced by the patient who is on metronidazole. That is diarrhea, or sometimes it can cause nausea, vomiting, or stomach cramps may be seen in the patient. It also causes dizziness and drowsiness. The counseling emphasis which has to be given from the community pharmacist would be take with food to decrease GI upset. There may be this drug may cause darkening of tongue or urine, and you should tell to the patient to avoid alcohol consumption. Second drug, ornidazole. This drug will not cause like bitter or metallic taste. So there is no bitter or metallic taste experienced by the patient who is on ornidazole, but it can develop interactions and disulfiram like reactions, which has to be very, very carefully monitored by the community pharmacist. Other drug would be secnidazole. Here also there is no bitter taste experienced by the patient. But just like ornidazole, the patient may experience disulfiram like reactions. Now, the medication adherence should be there always for better outcomes. Consult doctor immediately if you experience any serious or any unwanted effects from the patient. Now, next drug would be the paromomycin. The paromomycin, the side effects would be nausea, vomiting, loss of appetite, abdominal cramps, diarrhea, and heartburn is experienced by the patient. The counseling emphasis would be assure that the patient is not allergic to it or other aminoglycoside antibiotics such as gentamicin or neomycin. Next drug would be dialloxanide furoate. The side effects would be the flatulence, loss of appetite, itching, and some patient may experience hives. So the counseling emphasis would be take this drug dialloxanide furoate with or without food. Refer to physician if there is itching and allergic symptoms are experienced. So this is the community pharmacist where you can counsel about drug therapy to the patient, or he can give counseling to the patients if they are pediatric patients to the care providers. The summary of the whole amoebiasis is an infection of the intestine which is caused by Entamoeba Histolytica. The transmission is mainly through fecal oral spread of cysts, and incubation period may range from 2 to 4 weeks generally, and pharmacotherapy you can use the metronidazole, adequinol, paromomycin, dialloxanate furoate, secnidazole, and some other drugs like probiotics or antibiotics may be needed depending upon the clinical situation of the patient. And the main intention of the community pharmacist is to spread awareness regarding about the health and hygiene aspect by promoting health education, spreading awarenesses. And we have discussed about the principles of 5 A's, that is ask, assess, advise, assist, and arrange, the 5A principles of determining related to disease or drugs. And lastly, we have discussed about the role and responsibilities of community pharmacists, which is in the society regarding about the disease or regarding about the drugs and regarding about the spread of awarenesses. Thank you.